My name is Ashley Hightower. I'm a physical therapist assistant student with Jeff State Community College. And today we're going to be talking about a treatment for a patient that is diagnosed with shoulder instability. Shoulder instability comes from trauma to the shoulder. As you can see right here, these are the ligaments, the different ligaments that hold the head of the humerus against the glenoid fossa. And when trauma occurs, it causes stretching of those ligaments and it causes the shoulder to be unstable. Our patient here is a 34-year-old male diagnosed with shoulder instability. His symptoms began 2 weeks ago after he had a skiing accident. His arm was at a shoulder height and externally rotated while he was skiing, and he fell, and that's what caused his trauma in his shoulder and causing that instability. When treating a patient with shoulder instability, two subjective findings that you can reassess each treatment would be asking the patient what movements and activities might still be causing them pain in their shoulder. Another one would be ask them how frequently they're experiencing popping and clicking in their shoulder. You can look at two objective findings to reassess. You can look at their manual muscle testing for shoulder abduction, for the shoulder abductors, to see if their strength is improving. Also, you can look at measuring their range of motion for shoulder abduction to see if that is increasing. So when treating a patient with shoulder instability, we're going to do some soft tissue mobilization to the muscles surrounding the scapula, because this patient finds relief with holding his arm in a sling-like position. And while doing that, if he's experiencing pain, he's going to be guarding. He's going to be in a sling-like position, so he's going to have restrictions in the muscles, and that's causing him to have an altered scapulohumeral rhythm. So we're going to do some soft tissue mobilization to the muscles surrounding the scapula to help get those restrictions and help with that altered scapulohumeral rhythm. So you can just go along the borders of the scapula. You can do the medial border, just feeling for any restrictions that might be in there. You can do the medial border. And just feel for any knots or any restrictions. And once you find a restriction, you can apply a sustained pressure to that area, and it will help relieve that restriction. So you just follow the borders. You can do the spine of the scapula. And just feeling for any of those restrictions in there. And the sustained pressure to that knot will help relieve that restriction in there. Okay? So next, we're going to talk about some patient education for this patient. Mr. Parker, if you will, can you roll over on your back for me? So this patient experiences sleep disturbances because of the pain that he's having in his shoulder. So what we're going to do is we're going to use, when you're sleeping at night, Mr. Parker, you can use pillows to help support that joint. You can use one or as many as it takes. So we'll fold this one in half, and you can place it right there under your arm, and you want it to be level with your chest. You don't want to use too little of pillows, because that's going to cause your shoulder to be down, and that's not helping. It's still stretching the ligaments in there. So if you have it at the perfect height, right at level with your chest, it will help support that shoulder and decrease your pain at night so that you're not being woken up.
Okay.
Do you have any questions or anything?
No.
No? Okay. Next, we're going to talk about some exercises that we can do with a patient with shoulder instability. We're going to do external rotation isometrics. We're going to do this because the patient rated on his manual muscle testing for external rotators, a 4- out of 5. So we're going to do this exercise to help strengthen those external rotators and help with the stability in his shoulder. So Mr. Parker, we'll walk over here. I'm going to show you this home exercise for you. You let me know if you have any questions or anything. Okay. So I want you to stand next to a wall, a stable wall. I'm going to have your shoulder at a 90-degree angle against the wall. Have your back straight. Apply pressure into the wall. Just push into it with your arm, and then relax. Okay, and then push into the wall and relax. And just make sure during the exercise that you're breathing in and out regularly. Don't hold your breath or anything like that. And you just want to make sure that you don't feel any pain during the exercise. If you do, you might be applying too much pressure into the wall, and you just might need to reduce the amount of pressure that you're applying, okay? Okay. Okay, so if you will, let me see you do that one time. Just want to make sure you're doing it correctly. Okay. And relax. Good job.
This.
Yes, sir, that looks great. And you're going to want to do this 10 times. Do 3 sets of this. You can do it twice a day, Mr. Parker. Maybe once in the morning and once in the afternoon. Just remember to keep your back straight. Make sure that you're breathing in and out regularly. You're not holding your breath. And that you don't feel any pain throughout the exercise. So if you have any questions or anything about that, Mr. Parker, you just let me know. Okay, so that's the home exercise. The prognosis for this patient is very good. As long as he's meeting his goals in therapy and is making progress, he should be able to get back to his activities that he likes to do, such as skiing. He just needs to make sure that he is working hard and meeting those goals that he needs to meet. That's all I have for today, and thank you very much.